Assalamualaikum and good morning. Today I'm going to present to you all regarding one topic, which is a very important topic, and this topic is about the ears. Okay, before I'm going further to discuss on this topic, I'm going to introduce to you all regarding the different part of the ear that we have. Okay. For the ear, we have a three part: the external ear, middle ear, and also the internal ear. Okay, for the external ear, so we have a few number of component here. Okay, the auricle. So if you see from this picture, this is the auricle. The external acoustic meatus. Okay, this is the external acoustic meatus. It's like a channel. Okay, it's like a channel that lead toward the tympanic membrane. And then we have the tympanic membrane. So these are the three components of the external ear that you have to know. And then now we're going to move to the middle ear. Okay, the middle ear, we have the tympanic cavity, okay, space. And then we have the pharyngotympanic tube. And and then we also have the auditory ossicles and the muscles that are associated with the ossicles. Okay. Okay, these are the component of the middle ear. Okay. And then the internal ear, we have the bony labyrinth and also the membranous labyrinth. Okay, so you can see here, these are the part of the ear. So we have the external ear, middle ear, and also the internal ear. Okay, so now we're going to discuss deeply on the each of the component that I have mentioned just now. The external ear. We start to discuss on the auricle. Okay, so the auricle is an elastic cartilage. Is a cartilage, elastic. Okay, and the auricle, it has a several depression, and this depression is known as a concha. So you can see here, these are the depression we have on the auricle. Okay, maybe you can feel on your own ear. Okay, and then lobule. So if you see here, this is the lobule, and the lobule is without a cartilage. It's devoid of cartilage. And there are two artery that supply to the auricle. We have the posterior auricular artery and superficial temporal artery. So you can see here, this is the superficial temporal artery, and this is the posterior auricular artery that supply to the auricle here. Okay. Okay. For the nerve to the skin, so the auricle, it is supplied by the great auricular nerve. Okay. So if you see here, this is the great auricular nerve. So you can see how the great auricular nerve is emerged. And then we have the auricular temporal nerve that also supply to the auricle. Okay. And for the lymphatic drainage, the superior half, it drain into the superficial parietal lymph node and mostoid lymph node. Okay. And inferior half will drain into the superficial cervical lymph node. Okay. So if you see here, you can see here, this is the superficial parietal lymph node. Okay, that associated with the parietic gland, and at the back there we have the mastoid lymph node. Okay, and then this is the superficial cervical lymph node. Okay, number 2. Okay, okay, and now we're going to move to the next slide on otoscopic examinations. So in infant, how you check the infant's ear? So you need to pull auricle down and back. So this is the way you make. This is the way how that you can make the this channel or the acoustic meatus become straight. Okay, and then in adult you have to pull auricle up and out and back. Okay. Okay, and this is the purpose of actually to reduce the curvature of the external auditory meatus or external acoustic meatus lah. Okay, external. Now going to move to the next slide on the external acoustic meatus. Okay, external acoustic meatus, EAM. Okay, so this is the external acoustic meatus. For the external acoustic meatus, it is divided into two parts. The cartilaginous part. Okay, this is the cartilaginous part, and the bony part. Okay, for the cartilaginous part, it is the lateral third. okay, of the meatus. Okay, so this part, okay, this part it is lined with the skin. Okay, you can see here this is the skin that contain the hair, and the hair, the skin also it has a sebaceous and ceruminous gland, and these two gland it produce this gland, the ceruminous gland, sorry, the ceruminous gland it produce the cerumen. Okay, and for the body part, so you can see here, this is the bone. So body part is the medial to third. Okay, so mean that the body part is more longer compared to the cartilaginous part, which is only one third. Okay, so it also lined by the skin, thin skin, and this skin is continuous with the external layer of the tympanic membrane. Okay, so you can see here. So this is another picture that just to show you the cartilaginous part and also the bony part. Okay. Okay, for the tympanic membrane is a translucent, purely gray structure. Okay, and it has a shallow central depression, and the peak part here, the peak is known as a umbo. Umbo. The tympanic membrane it has two parts: the pars flaccida, which is flaccid, okay, pars flaccida, and pars tensa, which is tense, okay. And through the whenever you do a otoscopic examinations, so you can see there is a cone of light, okay, cone of light that radiate anterior inferior from the umbo. So this is the umbo. Okay. So just to recap back what I mentioned just now, this is the pars flaccida, this is the pars tensa. Okay. Okay, for the nerve supply of the tympanic membrane, so the nerve supply, okay, external, on the external part that's facing toward the external environment, the thin skin, so it is supplied by the auricular temporal nerve. So you can see here, this is the auricular temporal nerve that's supplied to the external part of the tympanic membrane. Okay, and the internal part, which is covered by the mucous membrane, it is supplied by the ninth cranial nerve. Okay. Okay, so you can see here, this is the right tympanic membrane. Okay, so we have the pars flaccida, we have the pars tensa, and then here, this is the umbo, and this is the cone of light. Okay, and this is the handle of the meatus. So whenever you remove the tympanic membrane, so you can see the bony structure, okay, inside there, okay. Uh, so you can see, and then beside that, you also can see the other structure. Like for example, here we have the condylar tympanic nerve, and then we have the stapedius muscle here. Okay, and then we also have the fossa for the round window. Okay, and this is the tensor tympani muscle, tympanic muscle, and this is the stapedius muscle that I have mentioned just now. And this is the stapes in the oval window that cover the oval window in the oval window. Okay, so you can see here, this is the tympanic membrane, the real one. Okay, okay, now we're going to move to the middle ear. Just now we have discussed on the external ear. Okay, for the middle ear, it is located at the located inside the petrous part of the temporal bone. Petrous part of the temporal bone is the hardest portion of the temporal bone. So I have still remember whenever I discuss regarding the scalp bone before. So the petrous part of the temporal bone. So I hope you know the way is the location of the petrous part of the temporal bone. Okay, so what are the components that we have here in the middle ear? We have the tympanic cavity. Okay, tympanic cavity, definitely the tympanic cavity lah. Okay, tympanic cavity. And we have above here, we have the, if you see here, we have the epitympanic recess. It's a space superior to the tympanic membrane. So this is the tympanic membrane. So superior to the tympanic membrane, we have the epitympanic recess. Okay. And then we also have a pharyngeal-tympanic tube here. This is the pharyngeal-tympanic tube. Uh, the pharyngeal-tympanic tube is located anterior part lah. So it connect with the nasopharynx. Okay. And then we have the toward the back. So this is toward the back. So at the back here we have the mastoid antrum. Okay, located at the posterior-superiorly. Okay, and this mastoid antrum it connect with the mastoid air cell. If you see here, we have the small hole here. Is actually is the the mastoid air cell. Okay. Okay, so this is the tympanic cavity on the lateral wall. Okay, on the lateral wall and medial view lah. Okay, so so you can see here, this is the epitympanic recess, and this is the cauda tympani nerve. Okay, you can see here. And then this is the tensor tympani muscle. Okay, you can see here. This is the tensor tympani muscle. And then toward the front here, we have the pharyngotympanic tube. Okay, or station tube lah. Okay. And then we also have the facial nerve here. So you can see here the cauda tympanic nerve is a branches of the facial nerve. Okay. And then this is the medial wall. So this is the medial wall from the lateral view. Okay, so you can see here, this is toward the posterior superiorly, which is the masseter antrum, that lead to the masseter air cell. And then we have the tympanic plexus here. You can see here, this is the tympanic plexus. And then we have the tensor tympani muscle here. And then we have the, toward the front here, toward the anteriorly, we have the pharyngotympanic tube. Okay. Okay, what are the content of the middle ear? We have the auditory ossicles, we have the malleus, incus, and also the stapes. This is the bone, small bone of the middle ear. And then we have the stapedius muscle, we have the tensor tympani muscle, and cauda tympanic nerve, semicranial nerve. And then we have the tympanic plexus of the nerve. So you can see here, just now, if you go back here, this is the tympanic plexus. Okay. Okay. Just to highlight back what I have mentioned just now, we have the cauda tympanic nerve, stapedius muscle, tensor tympani muscle. Okay. And the rest you can see on your own. You can see here, this is the incus, malleus, okay. Okay. And then we have the cauda tympanic nerve, branches of the seventh cranial nerve. Okay, now we're going to proceed with the next slide on the wall of the tympanic cavity. So we have the roof, we have the floor, we have four walls. Okay, for the roof, so it is formed by the tegmen tympani. So you can see here, this is the tegmen tympani. Tegmen tympani, it is separate from the dura mater. Okay, the floor of the middle cranial fossa. Okay, so you can see here, this is the floor of the middle cranial fossa. Okay, so and then the floor. So the floor, okay, the floor here, the floor is separated from the superior bulb of the internal jugular vein. So you can see here, this is the internal jugular vein. Okay, superior bulb of the internal jugular vein. And then we have four wall. We have the lateral wall, okay, lateral wall, medial wall. We have the anterior wall and posterior wall. So this is the anterior wall, posterior wall, okay, medial wall. Okay, this is floor, this is the roof. Okay. I hope you can imagine on how the orientation of this picture. Okay. And then on lateral wall, so this is lateral wall. This is lateral wall. Okay. Lateral wall, we have the tympanic membrane. Okay. And then we have above here, we have the epitympanic recess. And then this is the view of the medial wall. Okay. Medial wall is separate from the inner ear. Okay. It is separate from the inner ear. And then we have the promontory. Okay. Due to the basal turn of the cochlea. Okay. Promontory. Okay. And then anterior wall. So you can see here, this is the part of the anterior wall, considered part of the anterior wall. So we have the carotid canal. So this is the carotid artery. So we have the canal here, but it's not very clear here. Supposedly we have the canal. Okay. Okay, but here this is the carotid artery. Okay, you try to imagine how the direction of the carotid artery. So you can see here, okay, the carotid artery, and then supposedly we have in front here, we have the carotid canal. Okay, and then we have the opening for the auditory tube. Okay, opening for the auditory tube, the suction tube, auditory tube. Yeah, this is the anterior wall, and then we have the tensor tympani muscle. Okay, and this is the structure that form the anterior wall, and posterior wall. Okay, this is the posterior wall. Okay, the posterior wall, the auditus to the masseter antrum. Okay, and then canal for the facial nerve. And the facial nerve that descend. Okay, so you can see here, this is the facial nerve that descending. Okay. Okay, this is the toward the okay. So you can see this is more clear toward the posterior part. Okay. Posterior. Okay, so you can see on your own later. So you can see here, this is the toward the posterior wall. So we have the masseter antrum. Okay, and this is the medial wall. So we have the promontory. Okay, and this is the pharyngotympanic tube. Okay, and this is the structure that form the anterior wall and also the tensor tympani muscle. Okay, so this is tensor tympani muscle. Okay. Okay, now we're going to discuss on the pharyngotympanic tube. Okay, pharyngotympanic tube connect the tympanic cavity to the nasopharynx. Okay, connect the tympanic cavity here, the tympanic cavity here, okay, to the nasopharynx. So you can see here, this is the nasopharynx. Okay, so it opens posterior to the inferior meatus of the nasal cavity. Okay, opens posterior to the inferior meatus of the nasal cavity. So you can see here, this is the opening that we have posterior to the inferior meatus of the nasal cavity. Okay, this is the opening that we have in the nasopharynx. Okay, the opening, that connection from here to here. Okay, and then posterolateral third. Posterolateral third. Okay, posterolateral third. It is bony part. So posterolateral third. It is a bony part. Okay, uh, nearer to the tympanic cavity. Okay, so you can see here this part. This is the posterolateral part that, toward the tympanic cavity. It is a bony part, and the function of the pharyngotympanic tube is to equalize the pressure in the middle ear here with the atmospheric pressure. So that is the function of the pharyngotympanic tube. And then now we're going to proceed on to discuss on the auditory ossicles. So just now in the early part of my presentation, just now I have mentioned about that there are three ossicle, bony ossicle. We have the malleus, incus, and also the stapes. Okay, so these are the part of the bone that you have to know. Okay, so for example here the malleus, it has a head. Okay, head, very prominent head here, and then we have the neck and then the handle here. Okay, and then the tip here is known as the umbo. Okay, and then for the incus, so this is the incus. Okay, we have the body in the middle here, and then we have the long limb and short limb. And for the stapes, we have the head. Okay, we have the head and two limb. Okay, you can see here, this is the head, two limb, and we have the base. This is the base. Okay, so whenever you join or combine all the bone here, like this. So you can see here how the orientation of the bone whenever you combine all together. Okay, and then now we're going to move to the next part of my presentations on the muscle that associated with the ossicles. Okay, we have two muscle that associated with the bony ossicles. Okay, we have the tensor tympani muscle. So this is the tensor tympani muscle. So what is the function of this muscle is to pull the handle of malleus. Okay, it pull the handle of malleus medially. Whenever it pull the handle of malleus medially, so it will tense the tympanic membrane. So whenever the tympanic membrane is become tense, so it prevent the internal ear damage to loud sounds, because whenever it become tense, so the vibration will be lessened. Okay, so whenever the vibration will be lessened, so the transmission of the vibration to the internal ear will be lessened also. So it prevent the internal ear damage to the loud sound. So that is the function of the tensor tympani muscle. So this muscle, it is innervated by the uh, mandibular division of the trigeminal nerve. Okay, by the trigeminal nerve lah, mandibular divisions. And then this is the stapedius muscle. Okay, so you can see here, this is the stapes, right? Okay, so what is the function of this stapes muscle? So it pull the stapes posteriorly, pull the stapes posteriorly. So it dampen the vibration of the tympanic membrane. Okay, it prevent the excessive movement. It prevent the excessive movement of the stapes. Whenever you pull the stapes posteriorly, so it prevent excessive movement of the stapes. And this muscle is innervated by the nerve to the stapedius muscle, which is the branches of the seventh cranial nerve. Okay, now we're going to proceed to discuss on the internal ear. Just now we have discussed on the middle ear, right? So for the internal ear, where is the location? It's the same location like middle ear. It is located in the petrous part of the temporal bone, okay, the bony aortic capsule. So what is the function of the internal ear? We have two functions here that you need to know. We have the first function is for the reception of the sound wave, and then the second function is to maintain the balance. Okay, these are the two functions of the internal ear, the vestibular cochlear organs. Okay. And okay, we have two components also here in the present in the internal ear, the bony labyrinth and also the membranous labyrinth. For the bony labyrinth, it contains the perilimb. For the membranous labyrinth, it contains the endolimb. Okay, this is the bony labyrinth. This is the membranous labyrinth. Okay, for the bony labyrinth, it is a fluid-filled space. Okay, so you can see here, this is the bony labyrinth. It is a fluid-filled space. It composed of three parts. We have the cochlea. So you can see here, this is the cochlea, the eggshell shape, the shell. Sorry, the shape, the shell shape. Okay, and then the cochlea. Okay, the shell shape. Vestibule in the middle here, we have the vestibule, and then we have the semicircular canal. Okay, this you can see here the shell shape. Okay, okay, sorry. Okay, okay, the shell shape. Okay, no, okay, just now I wrongly mentioned that egg is not egg, the shell shape. Okay, shell shape. Okay, it is a shell shape, the cochlea. So okay, now I'm going to proceed with the next slide. Okay, the shell shape. The cochlea is a shell shape. Okay, the cochlea, it contains the cochlear duct. Okay, inside the cochlea we have the cochlear duct. Okay, what is the function of the cochlear duct? Is to function here is to for the hearing purpose. Okay, concerned with the hearing. Okay, the spiral canal of the you can see here. Okay, it is in the form in spiral canal of the cochlea. So you can see here the spiral canal. So that's why the cochlea is a shell shape. Okay, shell shape. Spiral canal of the cochlea, it begin at the vestibule. So you can see here, this is the vestibule. So it begin at the vestibule. Okay, it make 2.5 turn. Okay, 2.5 turn around the modulus. Okay, and modulus, what is the modulus? Is a core of a spongy bone. Okay, okay, core of spongy bone. In the middle here, we have the modulus, a core of a spongy bone. So whenever you it turn around like this, so it form one core structure. Okay, core structure, and this core structure is known as a modulus. Okay, so the modulus, it contains the canal for the blood vessels and also the cochlear nerve. So these are that are the content of the modulus. Okay, I move to the next slide just to show you the how the modulus is look like. Okay, so you can see here, this is the modulus. So the cochlea, right, it make a spiral turning like this. Okay, so in the middle here we have a modulus lah. Okay, modulus. Okay, you can see here, this is the modulus. Okay, go back. Okay, so in the modulus, it contains the canal for the blood vessel and also the cochlea nerve that I have mentioned just now. Okay, and then the promontory. The promontory, it is a basal turn of the cochlea. Okay, the basal turn of the cochlea. Okay, so you can see here the initial turn of the cochlea. So the promontory you can see on the middle wall of the tympanic cavity. So I hope you can still remember the promontory that I have shown you just now on my first my previous slide. Okay, and the cochlea, it communicate with the subarachnoid space via the cochlear aqueduct. Okay, so okay, you can see so you can see here this is the cochlear aqueduct. Okay, so the cochlea, it communicate with the subarachnoid space via the cochlear aqueduct. Okay, so you can see here, this is the cochlea. Okay, and we have the round window. The round window is closed by the secondary tympanic membrane. Okay, you can see here, this is the round window. Okay, so the round window is closed by the secondary tympanic membrane. Okay, so this is regarding the cochlea. This is the cochlea. You can see here the cochlea. Okay, so inside the cochlea, we have the cochlear duct. The blue color line here, the blue color structure here actually is the cochlear duct. Okay, cochlear duct. Okay. Okay, so you can see here, this is the cochlea. Okay. Okay, you can see here, this is the round window. Okay. Okay, the round window that covered by the secondary tympanic membrane that I've shown just now. Okay, so you can see here in the spiral form, osseous spiral lamina. Okay. Okay. So now we're going to move to the vestibule. So this is the vestibule in the middle here. Okay, this is the vestibule. So the vestibule is a small oval chamber. Okay, it's a oval chamber, a small oval chamber. The vestibule contains the utricle and also the saccule, and these two components or these two structure is actually involved in the balancing apparatus. So you can see here, this is the two components that I want to show you just now. This is the saccule and this is the utricle. Okay, okay, that present inside the vestibule. Okay, okay. On lateral side, on the lateral side, we have the oval window. Okay, so you can see here, this is the oval window. Okay, uh, oh, okay. This is the oval window, and this oval window, it is covered by the base of the steppiece. Okay, I hope you still remember what is the base of the steppiece, and this part is covered by the base of the steppiece, the oval window. And this is on the lateral side, and then anteriorly it's continuous. This is toward the anterior. Try to imagine this is toward the anterior. So anteriorly it is continue with the bony cochlea, and toward the posteriorly it continue with the semicircular canal. So you can see here, this is the semicircular canal. So try to imagine this is toward the posterior. And then we have the aqueduct of vestibule. The aqueduct of vestibule, it continues with the posterior cranial fossa. Okay, so you can see here, this is the aqueduct of the vestibule. This aqueduct of vestibule, it continue with the posterior cranial fossa. Okay, so you can see here, this is aqueduct of the vestibule. And aqueduct of vestibule, it open to the internal acoustic matters. And what is the function of this aqueduct of vestibule? It transmit the endolymphatic duct. So if you see here, so we have the blue color structure here. This is the endolymphatic duct. Okay, not only it transmit the endolymphatic duct, it also transmit blood vessels. So these are the two structure that transmitted by the aqueduct of vestibule. Okay, endolymphatic ducts and also the blood vessels. So you can see here. So this is the oval window that covered by the base of the steppiece. Okay. Okay. So this is the vestibule. Okay, now we're going to proceed with the semicircular canal. So semicircular canal is a three canal. So we have the anterior canal, we have the posterior canal, and also the lateral canal. So for the semicircular canal, it communicates with the vestibule of the bony labyrinth. Okay, it communicates with the vestibule of the bony labyrinth. And it lie posterior superior to the vestibule. Okay, the semicircular canal, it lie posterior superior to the vestibule, so it is located posteriorly lah. Okay, if we refer to the vestibule lah. Okay, so the semicircular canal, it is located posterior superior lah to the vestibule. Okay, each semicircular canal, it is a two-third of circle. So you can see here, it is a two-third circle. It's not a complete circle, two-third circle. Okay, 1.5 millimeter in diameter. Okay, 1.5 millimeter in diameter, and then it's set a right angle to each other. If you see from this picture, you can see here it is 90 degree to each other. Okay, set the right angle to each other. Okay, and then there is a swelling at each end, and this swelling is known as ampulla. So you can see here we have swelling at each end. Okay, and then it has 5 opening. Because why we only have 5 opening? Because the anterior and posterior canals, it form a join together to form a one common limb. Okay, so you can see here this one will join this one to form a one common limb. Okay, that's why we only have 5 openings here. Okay, and then what are the structure that present inside the semicircular canal? Okay, we have the semicircular duct present inside the semicircular canal. So you can see here, this is the semicircular duct. Okay, okay. So just to recap what I mentioned just now, the semicircular canal, it communicate with the vestibule in the middle here. Okay. Okay, so far? Okay. Okay, so now we're going to proceed with the next one. Okay. Okay, whenever you okay, this is a semicircular canal. Okay, so inside the semicircular canal, we have the semicircular duct. So this is semicircular duct. The structure inside here. Okay, it mean that you bring this structure into here. Okay, so you can see here how the just now I mentioned that we have three semicircular canal, right? Okay, so it's the same thing like duct also. We have the anterior, we have the posterior, and also the lateral. Okay, so you can see here it is set at the right angle to each other. Hmm? Okay, just now we have discussed on the bony labyrinth. Okay, now we can discuss on the membranous labyrinth. Okay, so the membranous labyrinth, it contains a series of communicating sacs and also the duct. Okay, and membranous labyrinth, it contains the endolymph, watery fluid lah. Okay, for the we have the vestibular labyrinth, we have the cochlear labyrinth. Okay, for the vestibular labyrinth, we have the three semicircular duct. Okay, okay, for the vestibular labyrinth, we have the three semicircular duct and also the utricle and saccule. Okay, so these are the components of the vestibular labyrinth, the three semicircular duct and also the utricle and also the saccule. Okay, and for the cochlear labyrinth, we have the cochlear duct. Okay, so just to recap back what I mentioned just now. Okay, membranous labyrinth, it contains the endemic watery fluid. Okay, and the secret. Okay, just to go, and then we now get back to the what I have mentioned just now. Okay, the three semicircular duct. It is located in the semicircular canal. For the utricle and saccule, it is located in the vestibule. So these three semicircular duct and utricle, it form the part of the vestibular labyrinth. And then the cochlear duct, it is located inside the cochlea. And the cochlear duct, it is part of the cochlear labyrinth. Okay. Okay. So now we're going to discuss on the how the communication that happened here. So you can see here, the semicircular duct, it is connected to the utricles, and then later it will be connected to the saccule. So utricle connected to the saccule by this duct, the utriculo-circular duct. So in the middle here we have the utriculo-circular duct, and then we also have the endolymphatic duct here. You can see here, this is the endolymphatic duct, and then the saccule will connected to the cochlear duct, and the duct that connect the saccule to the cochlear duct is a ductus reunion. Okay, so you can see here, this is the semicircular duct, right? Semicircular duct. Uh, so you can see this is the semicircular duct. Okay, you can see here semicircular duct, and then we have the utricle here, and the utricle is connected to the saccule by the utriculo-circular duct, and then we have the endolymphatic duct here. You can see here, and then the saccule is connected to the cochlear duct by the this one, the ductus reunion. Okay, so the endolymphatic sac. So you can see here, if you see here, we have the endolymphatic sac here. The endolymphatic sac, it acts as a reservoir for the excess of the endolymph. Okay. Okay. We discuss on the vestibular labyrinth first. Okay. The utricle and also the saccule. Okay. Vestibular labyrinth of the utricle and saccule. Okay. The utricle and saccule, it contain a specialized sensory epithelium. Okay. And this is a sensory epithelium, it is known as a maculae. Okay. So what is the function of this sensory epithelium? It senses the position of head and linear movement. Okay, these are the two functions of the maculae. Sense position of the head and its linear movement. Okay, the macula of we have two macula of utricle and macula of saccule. Okay, the macula of utricle, it is located on the floor of the utricle. So it is actually parallel with the base of the scalp. For the macula of saccule, it is vertically placed on the medial wall of the saccule. So you can see here the orientation is different. Okay, and the hair cell of maculae, it's supplied by the vestibular division of the vestibular cochlear nerve. Okay, vestibular cochlear nerve is divided into two branches, vestibular division and also the cochlear division. Okay, and the primary sensory ganglion of this vestibular division is located it is in the vestibular ganglion in the internal acoustic meatus. Okay, the primary sensory ganglion is located in the vestibular ganglion. It is present in the vestibular ganglion in the internal acoustic meatus. Okay, so you can see here, this is the vestibular ganglion. Okay, the primary sensory ganglion of the vestibular nerve. Okay, okay. So you can see here, this is the internal acoustic meatus. Okay. So this is the secure, this is the utricle. Okay, this is the macula seculi, macula utriculi. Okay, macula. How the direction of the position of the macula. Okay, in the secule and also the utricle. Okay. Okay, so whenever you view the macula under the the surface electron microscopy, so you can see here, this is the surface electron microscopy of macula in utricle. Okay, so this is the actually the view the features of the appearance of the epithelium. Okay, we have different type of hair cell. Okay, but this one will be discussed further by the, if not mistaken, by the physiologist now. So you can see here we have type 1 hair cell and type 2 hair cell, and above here we have a stereocilia. Okay, and then we have the kinocidium. Okay, and then we have the otolith membrane here. Okay, and then the next component of the vestibular labyrinth is a semicircular duct. Okay, so you can see here this is the semicircular duct. Each duct it has an ampulla at one end. So you can see here the dilated portion, the ampulla, and then we have the three ampulla. Okay, three, and for the ampulla, each ampulla it contains the ampullary crest. Okay, the crista ampullaris. Okay, each ampulla it contains the ampullary crest, the crista ampullaris. So the crest here is sensitive to the angular acceleration of the head. The hair cell of the crest stimulate the primary sensory neuron. Okay, the cell body are located in the vestibular ganglion. Okay, so I mean that inside the ampulla we have the specific epithelium. Okay, the sensory epithelium, the crista ampullaris, that sense to the angular that can sense the angular acceleration of the head. Okay. So you can see here, this is the structure of the crista ampullaris within the semicircular duct. So you can see here, this is the crista ampullaris. Okay, you can see. So you can see here, this is the hair bundle, this is the hair cell, and then the nerve fiber. Okay, so you can see here the positions of the crista ampullaris. Okay, and then now we're going to the next one, the cochlear labyrinth. Okay, just now we have discussed on the vestibular labyrinth. Okay, here is the cochlear labyrinth. So the cochlear labyrinth is a cochlear duct. Okay, the cochlear canal, it is divided into three scalae. Okay, the cochlear canal is divided into three scalae. We have the scala media, we have the scala vestibuli, and scala tympani. Okay, for the scala media, it is the actual, the middle part. The middle media is a middle, scala media. It's a middle in the middle, and this scala media is the actual cochlear duct. The actual cochlear duct. And the scala media, it contains the endolymph and continues with the saccule. And the scala media also contain the organ of the corti. For the scala vestibuli and scala tympani, okay, scala vestibuli and scala tympani, it communicate with each other at the apex of the cochlea via the channel called the helicotoma. So you can see here, in the middle here is a scala media. Okay, in the middle here, scala media. We have the scala tympani here, we have the scala vestibuli. So whenever you turn like this, you can see that there is a communication between the two, scala vestibuli and scala tympani. So if you follow the arrow here, the blue and also the red color one, okay, it is continuously, okay, continuous. So you can see here, scala vestibuli, this is the scala tympani. Okay, and then middle here we have the scala media. So the scala media actually is the cochlear duct, the actual cochlear duct. It contains the endolymph, and it also contains the spiral organ of corti. Okay, okay, the spiral ligament. So you can see here, the spiral ligament is it's secure cochlear duct to the cochlear canal. Okay, the spiral ligament. Okay. Okay, so you can see here, this is a spiral ligament. Secure the cochlear duct. This is a spiral ligament. Cochlear, secure the cochlear duct to the cochlear canal. Okay, spiral ligament. Okay, now we're going to discuss on the cochlear duct. Okay, specifically. Okay, the roof. Okay, the roof it is formed by the vestibular membrane. So if you see here, you can see this is the vestibular membrane, and the floor is a basilar membrane. Okay, vestibular membrane, basilar membrane. Okay, so the floor here, the basilar membrane, it contains the receptor of the auditory stimuli for the reception of the sound wave. Okay, the spiral organ of the corti. So you can see here the specific, the special epithelium. Okay, the spiral organ of corti. The spiral organ is covered by the tectorial membrane. So you can see here, this is the tectorial membrane. Okay, that covered the spiral organ of corti. Okay, and the tip. Okay, you can see here the tip of the hair cell. Okay, the tip of hair cell of the spiral organ are embedded in the tectorial membrane. So you can see here it is embedded in the tectorial membrane. Okay, the tip of the hair cell. And the spiral organ of corti, it is consists of the inner hair cell, outer hair cell, inner and outer pharyngeal cell, and also the pedal cell. Okay, inner hair cell and outer hair cell. Okay, spiral organ of the hair cell, spiral organ of the corti. So you can see here, this is spiral organ of the corti. And inner hair cell is closer to the osseous spiral lamina. So this is the inner hair cell. Okay, and outer hair cell is further away from the spiral lamina. Okay, this is the osseous spiral lamina. Okay, so far okay. Okay, and then just now we have a three component of specialized sensory cell in the membranous labyrinth. We have the crista impellaris. There are three in the semicircular duct. Macula, we have two in the utricle and saccule, and the spiral organ of the corti of the corneal duct. Okay, thank you. I think this is just additional information. You can read on your own. Okay, what are the clinical important that you need to know? Okay, so there are few number of clinical important here. For example, the otitis externa that involve the inflammation of the external ear, and then we have the subacute otitis media, the infection and inflammation of the medial ear. Usually, infection is spread from the nasopharynx via the auditory tube, and then we also have sometimes there is a perforation of the eardrum, and then we have the internal ear injury that can lead to the deafness and also the vertigo. Presbycusis is a hearing loss that occurs with the aging, and it is due to the degenerative disease of the organ of the corti. Whenever the organ of corti is degenerate, so it lead to the hearing loss, and the hearing loss is known as a presbycusis. And then we have the acoustic neuroma, schwannoma, due to the peripheral nerve tumor of the cranial nerve, the benign tumor of the originating from the Schwann cell. Okay, and for the deafness, nerve deafness is due to the disease of the cochlea and also the cochlear nerve. Okay, I hope you enjoy our session today. Okay, thank you.